Hello, my fellow Margamaniacs, progressive procrastinators, glorious drifters across America, Canada, and the world. Welcome to the Daily Stock Show. It's your show. We talk about money, how to make a ton of money and have fun along the way. We talk to inventors, innovators, and policymakers. We explain how new emerging technologies and regulations can affect your bottom line. We introduce good companies that have the potential to change the world. On today's show, the visionaries behind Metsera, Whit Bernard, and Clive Meanwell, from music and medicine to multi-billion-dollar deals. Whit Bernard, from music to medicine. Bernard, 41, began as a music scholar, studying how musical activity fueled non-violent uprisings in the Baltic states during Perestroika. He published his research in English and Latvian while on a Fulbright scholarship. Non-profit to business. After leading a contemporary music non-profit in Brooklyn, he pivoted to business, earning his MBA at Northwestern and joining McKinsey. The turning point. At McKinsey, Bernard met Clive Meanwell, then CEO of Medicines Co. Their partnership led to the $9.7 billion sale of medicines to Novartis in 2019. Entrepreneurial leap. Bernard co-founded Population Health Partners, targeting the top 10 drivers of death and destruction, with obesity near the top. From jazz improvisations to biotech strategy, Bernard's journey shows how curiosity and adaptability can scale into billion-dollar impact. Clive Meanwell, the strategist of scale. Early inspiration, born in Louth, UK. Meanwell studied virology at Birmingham, inspired by the TV series MASH and its portrayal of combat doctors. Research to leadership. He ran cancer programs at Roche in the late 1980s before moving to the US, realizing his passion lay in bringing drugs to patients, not just researching them. Medicines Co. at Legacy. Founded in 1997, Medicines Co. specialized in acquiring overlooked late-stage drugs. Its cholesterol drug Leqvio, developed with Alnilam, became the crown jewel that Novartis bought for nearly $10 billion. Population Health Partners. With Bernard, Meanwell shifted focus to common diseases like obesity, betting that tackling widespread afflictions would yield both impact and returns. Meanwell's genius lies in spotting overlooked opportunities and scaling them into industry-shaping deals. Building Metsera vision. Together, Bernard and Meanwell saw obesity as a massive unmet need. 40% of US adults are obese, raising risks of diabetes and stroke. Strategy. They acquired assets like UK-based ZHIP, spun out of Imperial College peptide research, and built Metsera's pipeline of next-generation GLP-1 therapies. Innovation. Metsera's standout candidate, a monthly injectable, promises greater convenience than weekly shots like Novo Nordisk's Wegovy. Early trials showed 14.1% average weight loss beyond placebo. Impact. Analysts estimate Metsera's pipeline could generate $5 billion in peak annual revenue. The payoff Pfizer's acquisition of Metsera, worth up to $10 billion, cements Bernard and Meanwell's reputation as serial deal-makers. Their firm, Population Health Partners, owns 12% of Metsera, netting over $1 billion from the sale. Beyond profit, their mission remains clear. Expand access to weight loss drugs for the hundreds of millions who need them. The bottom line, Whit Bernard and Clive Meanwell embody the blend of vision, adaptability, and execution that defines modern biotech leadership. From music halls and virology labs to boardrooms and billion-dollar exits, they've proven that tackling the world's biggest health challenges can also create legendary business stories. You've been listening to the Daily Stock Show. We bring clarity to the clashes that define markets. Please share with your friends and family, and forward to people you love. As always, your comments are welcome. For actionable, market-moving ideas, sign up for our newsletter. Visit dailystockshow.com.